Medication-assisted treatment is a means of medical care during recovery where we use medications during the recovery process, even long-term, that helps the patient stay clean and sober. There are a number of these medications, and they're specific typically to the drug of choice, but they really, in most ways, help work on the craving and reward center of the brain. So the substance isn't as interesting. It doesn't have the same effect on the patient that it used to. Some medication-assisted therapies that we use actually block the receptor in the brain where the drug normally binds. And that not only helps with the craving and reward and that sort of thing, but also protects the patient from an overdose. So medication-assisted therapy is a critical part of recovery and recovery care that we highly encourage and offer to all of our patients.
Medication-assisted treatment is one tool for treating the patient in terms of the whole patient concept. There are a variety of medications we could help and provide to a patient to help decrease their risk for relapse, help decrease cravings, and make sure they're maintaining sobriety and continuing on with treatment.
There is more than just an addiction to a substance or a chemical imbalance that goes into addiction. There are genetics, there are social circumstances, there are the drugs, but various drugs and substances can be abused. So we at Sandstone understand that simply addressing the medical issues does not usually put a person into meaningful recovery. It's really important that they do the trauma therapy and the mental health work and address some of the social issues surrounding their recovery to really give them the best chance in achieving a meaningful recovery. I would say a vast majority of patients are agreeable to at least trying the medications, and they will have close medical follow-up in case of an adverse reaction or a side effect in any way, which again are super rare. But some patients do choose not to take MAT, and that is their choice.
Naltrexone is an opioid antagonist, so meaning it blocks that receptor in your brain. Vivitrol is the intramuscular injectable version. So long-acting, it's good for 1 month and allows people to not have to take a pill daily. Naltrexone is predominantly used for opioids, but can be also used for alcohol as well, since both alcohol and opioids target that same receptor in the brain.
When this is taken, it essentially blocks the opioid receptor in the brain so that opioids can no longer bind and give the euphoric, pain relief, rewarding effects that opioids are essentially designed for. Naltrexone and Vivitrol have also been shown to have great benefit in alcoholism, in that, again, simply by binding to that receptor, we get a decrease of the euphoric effect of the area in the brain that makes alcohol essentially desirable to someone abusing alcohol. Buprenorphine is actually under the brand name Subutex, and then buprenorphine combined with naloxone is what we call Suboxone, and there are other brand name derivatives. So those are oral type medications that are actually dissolved in the mouth, and those are partial opioid agonists. So instead of completely blocking the receptor like naltrexone or Vivitrol, they can take something that's bound to the receptor and knock it off, or they bind to empty receptors. And they usually have a longer duration of action than most opioids. And because they bind to those receptors and stay there, if a person were to take an opioid on top of that, the opioid wouldn't have an effect because the receptor is already bound.
Buprenorphine has a ceiling effect associated with it, so it doesn't allow you to essentially OD on it. In addition, it helps decrease cravings for opiates in general, allows people to stay in treatment longer, and allows them to kind of develop a newer path in their life so that they're successful and sober.
Methadone is an opioid. It is not a partial agonist or an antagonist like the other forms of medication-assisted therapy for opioid use disorder. It is just a normal opioid like the other prescription medications, but this one is different in that it has an extremely long mechanism of action, a long half-life. So instead of the effects of the drug really coming on quickly and wearing off quickly, methadone is a long, slow, and steady type release. And in this way, patients are not constantly seeking, the next dose of the medication. They can just take it typically once a day, and feel fine and normal until the next dose is due. But again, it's a regular opioid, so there's the potential for you to need an increased dose perpetually. Sandstone uses a variety of medication-assisted treatments, and it, again, is specific to the individual patient and especially specific to their drug of choice. For patients seeking recovery from alcohol after the detox, we do offer them things like naltrexone. There are medications such as acamprosate or Camprol that we can use. For opioid use disorder, we do use a lot of Suboxone, and we use it even in a harm reduction stance where having a patient whose drug of choice is opioids and giving them Suboxone protects them from a potentially fatal overdose. And with the fentanyl crisis, overdoses are imminent. They are going to happen. And so even getting a patient that slips up, but they've been taking their Suboxone, very well could save their life. So we really, really try to encourage Suboxone if there isn't a medical contraindication. There is an injectable Suboxone-like medication called Sublocade, and it is similar to Vivitrol in that it's an injection you get once every 4 weeks, so you're not having to take the Suboxone daily or twice a day. Typically, we don't give that at Sandstone, but we, again, would help coordinate the care to get the patient the medication-assisted therapy that they need. Medication-assisted treatment is crucially important to the recovery journey, but it is not a magic wand. It is not going to cure you. There is no cure for addiction, but we can get people into meaningful recovery. Medication-assisted therapy is a tool to use to help aid your recovery and make it easier and potentially protect a patient from an overdose. But with that in mind, knowing that it's not the only tool that the patient will need to utilize to achieve meaningful recovery.